This episode of Ask the Doc, I got a great question about someone dealing with plantar fasciitis, tendonitis of the Achilles tendon, and having trouble walking as soon as they get out of bed every morning. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we are on a hell of a mission to make chronic injuries obsolete by helping those that are injured and in pain get properly educated and informed on their injuries and access to quality hands-on soft tissue treatment so they can avoid bigger problems down the road like pain pills, injections, and surgeries, which only make things worse. So back at it for Ask the Doc. Got a great question I'm going to read off. Every morning when I get out of bed, my foot hurts like crazy and I limp around for at least 10 minutes. I was diagnosed with plantar fasciitis and Achilles tendonitis. I do all the stretches, got new orthotics, and even had an injection, but it's getting worse, especially in the mornings. The part that doesn't make sense is why it always feels better when I use it more. Any insights? Thank you so much for sending that question in, and once again, sorry to hear you've been dealing with this problem for a long time. You're just getting stuck in that never-ending merry-go-round, or the nightmare that is the current medical model. One thing we'll start with is tendonitis is not a diagnosis, and plantar fasciitis is not a diagnosis either. In the medical model, what we always try to do is we try to simplify things. And the reason they simplify things is to make it easier for coding, for insurance companies, for the doctors to get reimbursed. And at the end of the day, if we don't know what a problem is, we can't fix it in the first place. So we default right away. If the bottom of the foot hurts, it must be plantar fasciitis. If the back of the heel hurts, it must be a tendonitis. None of those really tell us anything. We always must get to what's called a tissue-specific diagnosis and getting in there and figuring out exactly what's going on. The issue, what you're seeing here, is this is not a tendonitis. This is not a plantar fasciitis. It's actually something a lot worse. It's actually some degeneration to the fascia, the tendon in the foot, and it really behaves in a certain way. So what I want to include first this week is an older video where I talk about this idea that it's not tendonitis, it's actually something worse called tendinosis. So I'm going to link that up right now. Hello everyone, getting our educational video out. Today I want to talk about the idea in the diagnosis of tendonitis and how it's one of the most common diagnoses out there for injuries in the body, but it's actually incomplete and is actually very uncommon compared to something worse. So what we pulled up here was the Wikipedia page on tendonitis. Basically, tendonitis means inflammation of a tendon. Is a type of tendinopathy often confused with the more common tendinosis, which has similar symptoms but requires a different treatment. That's the key, the different type of treatment. That's very basic, but it means a big deal of a lot of things. So a lot of people are walking around when they have pain in their elbow, wrist, forearm, shoulder, anywhere. They get this diagnosis of what's called tendonitis. Tendonitis just means that it's inflamed. But if it's something that's chronic and been going on for a long time, a lot of those situations are actually isn't inflammation in there. There's actually something a lot worse, an actual degenerative component of the tendon. So when you look at a tendon, normal healthy one basically looks like this. It looks like spaghetti in a box before it's cooked. It's really strong and it would be really hard to snap. That's a normal healthy tendon. But over the years with wear and tear, bad mechanics, injuries, inflammation, everything on that, the tendon really gets beat up because the muscles around there aren't working correctly, and it develops what's called a tendinosis. So a tendinosis is, if we look under a microscope, a tendinosis looks like cooked spaghetti. The problem with that is that area of the tendon is very weak. It doesn't get good blood flow, it doesn't get good oxygen, and causes the pain and inflamed type of feeling that you're feeling. What's going on in the current medical model is everyone is addressing tendinosis thinking that it's a tendonitis and they want to get the inflammation down, so they inject it with cortisone. When you do that, that actually speeds up this tendinosis process, makes this tendon even more degenerated, and they're actually showing more and more if you're likely to get a tear or some type of problem, it's because you had a tendinosis first and the cortisone makes that worse. So there's a big difference in the proper type of diagnosis. So if you're walking around with a tendonitis type of diagnosis, you've done multiple injections, and you're still not any better, it might be time to figure out that you actually have something way worse, a tendinosis, and those are more likely to tear. The difference is very important, and the difference is in the details. Hope you got something out of that video and got some knowledge and understand that it can be a bigger problem. And the problem we run into in the musculoskeletal treatment world is we spend so much time treating the effect instead of looking at the cause. Like, the tendon is getting overloaded because a lot of other things aren't working correctly. And what's really happening, and I see this a lot, is what's called scar tissue formation. And this happens in the muscles in the foot, happens in the muscles deep in the calf, and the front part of the shin as well. We just really beat our bodies up and they get overworked. And when muscles get overworked, they don't get enough blood flow, they don't get enough oxygen, and they cause this scar tissue formation to happen. A lot of people are like, well, how the heck did I get scar tissue? I never had an injury in the first place. This can happen just from repetitive overuse and constantly working these muscles more than they should. This is why the stretching isn't actually helping. So think of that scar tissue formation as like a cavity that gets in there, and what you're trying to do with a stretch is fix it by brushing and flossing it. That's not going to work. It actually makes it a little more irritated where it temporarily feels better, but it's not actually fixing the problem. Imagine if you tried to fix a cavity in your teeth by brushing and flossing it. It would hurt like hell. This is why stretching isn't helping, because it's not breaking down that bad tissue in there. So what you need to do is you need to get it properly diagnosed. Do not accept, the basic junk box diagnoses of tendonitis, plantar fasciitis. Ask more questions. Get to a practitioner that can really help. And honestly, the best practitioners in the world are trained in my methods, the 𝑃ECK method, and you can get access to one of them by finding all the information down wherever you're consuming this video. If you like the video or it can help somebody, share it with somebody else. That's the best compliment you can give us. Don't accept nonsense diagnoses and just blatant treatments of let's inject it, let's stretch it, let's put some orthotics on there that isn't going to fix anything. And lastly, if you got any questions or specific injuries you want me to cover, send them in. We're always happy to help. I appreciate you guys, and I'll see you on the next one. Bye.